we are in having the most effective measures in place to slow the spread of a virus that is spreading. Of particular importance to me is protecting our frontline medical personnel. And we need to be very proactive in protecting those folks, our medical professionals in our hospitals particularly. In a situation like this, it's critical that we elevate their safety and well-being very high, because in a situation like this where the wheels could fall off is in a situation where our medical professionals are exposed to the virus and get taken out of the mix due to the need to isolate for whatever amount of time that might be. That's been a scenario in other areas where things have gone bad, and that's something we need to protect against here locally. Copies of the orders we've signed will be posted online immediately following this. Included with those orders is also the comprehensive guide detailing the categories of essential services from the governor's order yesterday. Balancing the interests and the priorities of our community will always be a difficult challenge, but we feel that the steps we've taken remain consistent with the needs that the community faces, and the mayor and I believe that this is the right step for the community. So with that, I'll turn it over to Mayor McCoy.
Thank you, Judge. As the judge alluded to, this is kind of a continuation of what we've done before. Our March 21st orders were a clarification to orders that were put in place by the governor. And we, like we said, we had been preparing orders for well over a week in the absence of the governor's orders. And it just so happened that yesterday, when those orders came, as we said, we had to go back. And I think we were very pleased to see that much of what we had worked on was still valid, but we needed to tweak it in response to the governor's orders. So again, we've issued those orders, but as I have said repeatedly for weeks now, yes, we have orders in place, and yes, there are some legal ramifications and binding to it, but the success of these orders is still contingent upon you as citizens taking the personal responsibility to follow the orders. And I can't iterate that more than I have in the last few weeks. Again, we're telling you now, kind of you shall, but still we want to depend upon you to be responsible and take responsibility to follow these orders and recognize the importance of them is not so much to yourself, but to others. So that, again, I want to repeat that over and over and over. And we've put a lot of thought and a lot of work into these orders, and I think that if they're followed, it will go a long way toward what we've all talked about, flattening the curve. Thank you.
Thank you. We'll now open it up for any questions.
It looked like it started
Okay,
on
yep,
the-
go for it. So can you give us, in layman terms, some bullet points on these new orders? Please?
Sure. The question was, in layman's terms, bullet points on the orders. It's a stay-at-home order requiring residents in the community to stay in their homes except for the efforts to provide or acquire essential services. Those essential services are detailed in length in the CISA guidelines from the federal government, which identifies each category of essential service and gives examples and detailed descriptions of those. So certainly essential functions, going to the pharmacy, the grocery store, essential things can still be done, but other activities, certainly social gatherings, recreational activities in groups cannot be done. I specifically noted, and we specifically included the verbiage related to sick individuals. One thing we're seeing in multiple confirmed cases is sick individuals going to work, whether knowingly or unknowingly. You've got people who are symptomatic going to work, getting other people sick. So that is explicitly not allowed. Other items include, and the additional step we took over and above the governor's order, was to apply social distancing guidelines to even those essential businesses. We've gotten complaints about the big box stores, about certain places that are essential and that will remain open, but in the order we've issued, social distancing protocols have to be taken by even those that are considered essential. So those are a few things there. I think in theory and in principle, a lot of what the governor put in his order mirrors ours. Some big differences are whereas he portrays some things as suggestions or phrases them confusingly, we try to be more clear.
Can you give an example?
Sure. Well, definitions in the governor's order, one of the phrases that I saw, well, one apparent one is the infrequent, you see lots of things listed as should, people should do this, and then in other areas it's you shall do this. A reasonable person would assume that the shall means you have to, the should means that you ought to. One's a mandate, one's a suggestion. And that's used inconsistently throughout both of those terms. So that's one area that we tried to shore up in ours. Another area in my mind was the definition that is not defined, essential daily activities. What does that mean? In many ways, a lot of this will always be an ongoing discussion as to the meaning, but to the extent that we were able, the mayor and I tried to make this as simple as possible, which is a huge undertaking. This is not a simple process, but we tried to make it as clear as possible. Without a doubt, there will be many, many people looking to see if they or their businesses fall within that list of essential services outlined in the governor's order. The best initial step to take would be to go online, whether to our website later or to the website itself, and get the CISA document, which details each of those categories and gives examples of what might fall into it. I think that document is a good guidepost for us to use. One concern that I've noted repeatedly was in many jurisdictions, stay-at-home orders, the somewhat arbitrary assignment of essential versus non-essential. With this document, this comes from the feds in a detailed effort to really identify the industries, the services that are critical to our nation, to our communities, and that's put in there. Some additional things that we did do, separate than the governor's order, was to include daycare services as an essential service for folks who fit in these categories. So the parents or caregivers who fall within these categories, daycare services remain an essential service for them. And I know as much as we've tried to make it as simple as possible, it can still be confusing to a lot of folks. We will be working with the members of our hotline call center to be as helpful to the public as possible in answering the questions that we know are going to arise. Some of it could be seen as subjective in this document, but there's not a good way around that. But those are a few differences there, Ingra. Probably too lengthy an explanation to your question, but.
No, it definitely gives us some, and this will be posted right after the meeting, so we can
Sure.
go through that. And the only other question I had immediately was the timeline. So it goes into effect
Sure.
this evening?
It goes into effect tonight, and it mirrors the timeline from both the President and CDC recommendations as well as the governor's order during the month of April.
For April?
Correct.
Throughout April?
Correct, correct. Yes, ma'am.
So as for the stay-at-home order, what does this mean for people who may be coming into Victoria County? Maybe they work somewhere else and they have to travel back and forth because they're essential, or maybe they're just now getting back home. What does that mean for them?
That's an excellent question. Within Victoria County, if they're out and about going somewhere, it would need to be either in providing or obtaining an essential service.
Just quickly on daycare centers, as you mentioned, the governor's order wasn't clear on those.
Correct.
So just to confirm, I know this is multi-layered, you can continue to send your child to a daycare center if you yourself are an essential worker. Is that a fair way to say it?
Yes, that is a fair way to say it. And I've got the verbiage in the
Okay.
document, but I would think that's
Okay.
a fair way to say it, yes.
Okay, and then also, the governor's order exempted religious institutions.
Correct.
And it is my understanding that even if you wanted to, you could not, I guess, go against that part of his order. What is your recommendation for churches that will remain open?
Sure. Well, the constraint of social distancing would still apply
Okay.
to religious institutions.
Right.
The best advice I would have to churches is, the churches I've seen, really without exception, has been that they've moved to an online format, and that would be my recommendation throughout the month of April. However, there have been, and it would be, and I know the governor particularly identified it as being permissible, the arrangement where families drive up to a parking lot large enough to accommodate it, and they would stay in their vehicles, and there would be either a sermon or a message or the service provided, but people stay in their vehicles. That, both in our understanding and hearing the governor answer that question, that would be fine also, in keeping with the order he handed down.
Okay. And then just going back briefly, you mentioned that anybody who's sick, whether or not they're having COVID-19 symptoms, they have to stay home.
If they are sick with the COVID-19 symptoms,
Okay.
I'm looking at specifically how that was, the verbiage, and again, this will be online, but as it is written in the order, any person experiencing symptoms consistent with COVID-19 is ordered to isolate at home, except to the extent necessary to get healthcare services, until, and then it gives the criteria of when that would be
Okay.
waived or removed.
And for folks who are waiting for a COVID-19 test, the whole family has to stay home.
Correct.
Okay.
Correct, yes.
And you'd mentioned that there were, some of our cases, folks were sick and went to work.
Yes.
Do we know if they knew that they had COVID-19 when they went to work, or they just went to work thinking it was a regular cough or
That'd
cold?
probably be at best addressed to Dr.
Dr.
McNeil and
McNeil.
David when they come in. I know for fact there were multiple instances where they did not know at the time that they had it. Were there instances where someone who knew they were confirmed was still out and about? That I don't know, but I know for sure there were people who were later confirmed to have it, but previous to that had been out and about, certainly while they were still in the danger zone of being able to spread that to others. And that, we've seen that, and that's a big problem. This is spread from sick people to well people, and that is an area where clearly we need to improve upon.
And are the penalties the same as in your previous order?
Yes.
Pretty much, yes.
Yeah, well, I haven't been repeating the questions. Were the
Oh, sorry.
enforcement mechanisms, penalties the same? They are the same, whether in the governor's executive order or local order. That's just a function of state law. Yes,
Okay.
ma'am.
And to this point, we haven't issued any citations or had to enforce anything?
I'm not
Not that
aware
I'm
of
aware
any
of.
citations
Okay.
being issued. I know we are getting calls, more so with questions about opinions, definitions, and whatnot. To my knowledge, as of now, I don't think there have been any citations
Okay.
issued.
Okay.
I could be wrong about that. I haven't spoken to any law enforcement folks today on that specific question. Mayor, are you privy to any information?
I've not heard
Okay.
anything to that
Okay.
effect.
And then I also wanted to ask, I'm not sure if this is addressed in your order, but about jail, our jail is a congregate facility. We're seeing some counties take steps like releasing inmates awaiting trial. Are we considering any steps there to limit the spread?
There's been no direction from me to anybody with the sheriff's office, the jail, as to releasing inmates. That's not something that Chief Boyd has implemented to my knowledge. I know there are jurisdictions, Harris County in particular, that made headlines with that effort to release certain categories of inmates. That's not something we've been pursuing here in Victoria County.
Okay. Do you think it would be in part of the conversation in the future,
Yeah.
depending on how it
Yeah,
spreads? Or
at this point, I'd have to defer that to Chief Boyd to be able to best answer that question.
When I spoke to him the other day, any inmates that had been released here locally were not from local orders that came down from like the Attorney General's office. And from my understanding, they were all nonviolent offenders and people who maybe had issues with child support or anything like that. And I also just heard back, Victoria Police Department has issued no citations as of right now.
Good to know.
And just to clarify something that we haven't talked about for a while, at this point, do we only have, I guess, county residents in the jail? I know that some of the,
Well,
or I guess only local arrests in the jail. Other jurisdictions are not sending us,
I know the
folks
number
anymore.
coming in from outside jurisdiction has definitely slowed down.
Okay.
I would think of the 350 some odd inmates in there, some would be continue to be outside of Victoria County. But Chief Boyd would be the subject matter expert on that with the most recent numbers. Those numbers change on a daily basis, the jail occupancy.
okay. And are there any plans to expand the hours of the hotline if folks, and is that the best place for folks to call if they have questions about the order?
It is, and like I say, well, the question is the hotline the best source of information for the many questions that will arise? The answer is yes. I know we've talked about in our policy group, working to make sure those who field those phone calls are educated on the details of the new order. Also, having perhaps an attorney there to help answer if there's any legalities, legal questions. But yes, the hotline is the best source of information, and we'll be prepared, if needed, to expand the hours that we operate that hotline.
That's one of the things that I've been concerned about, because once the governor's order hit, I can tell you when I got, I told you I'm going to go home and read the order last night. It was a difficult thing for me to do because everybody was emailing me, texting me, and asking, am I essential service? Am I an essential service? Well, if you go to this document, the CISA document, it's like a lot of federally created things. There's multiple categories. It takes a while to go through and understand. But there is also a mechanism within the governor's order itself that directs people to a TDM site that if you think you're an essential service and you're not listed in this document, they ask you to, there's a form on their website that you can fill out explaining why you think you are an essential service. And it's my understanding that as those things come in or improved or approved, we will see additions to this list of essential services. So if people really have a compelling argument, going to that site and asking to be listed as an essential service is really a more binding thing than us trying to interpret whether you are or not, if you understand the difference in the two. See?
Yeah, and one thing too, and that's a good point, Mayor, a good channel for folks to follow if they have that issue. We also plan to be putting out some helpful infographics, some easy to understand resources so that people can answer commonly asked questions without having to go through a bunch of pages or download a PDF, the simple questions that immediately arise. Again, there will be a lot of questions related to this. There's no easy way around that. Other options, other orders we considered, we felt would lead to even more questions than the ones we know we're going to get with this. This, as we've said before, is not an easy task. It's not a simple task. It's complicated world of moving parts and many different factors for us to consider, but we think what we've put forward is really nothing more than what the situation that we're in necessitates, and nothing less than what our responsibility to this community allows us to do. It's not something we would ever ask for, but it's something we feel we should do, and so as of midnight tonight, that'll go into effect.
Judge Zeller, just to clarify, the website and the website where this information will be on is?
That's VictoriaTXOEM.org. VictoriaTXOEM.org, and we'll have those same documents, I presume, put on all the Facebook pages, the county, the city, and certainly our Victoria Health Department Facebook page, but yes, ma'am.
And I know that there will be a lot of additions and changes, as you said, as people call in and state their case. And movement, will those updates be done on a regular basis?
Yes, so actually, I just got word that our orders in the Seesaw document, along with the governor's order from yesterday, are on our website now.
Okay.
So that's VictoriaTXOEM.org. Those are on there as we speak, so you can click over and look at them. We're going to be updating everything as soon as we can. Since information does seem to be changing quickly already, what we have done is set a 5 p.m. deadline to get new information every day going forward. And so at 5 p.m. we'll get that, and as soon as possible after the fact, we'll have that all updated online. So any new numbers, exposure locations, anything like that, going forward, since everything is changing quickly, that is our goal. Oh,
I'm sorry.
1 second.
And my question was, will we be able to access that Seesaw document on the OEM website?
Yes, ma'am. Yes,
It's
ma'am.
on there now, and you can also go to cisa.gov for more information on that.
Okay, thank you. Mayor, Judge, could we just talk briefly about the requirements you'll have of businesses that are deemed essential? You'd mentioned kind of big box retailers, kind of what you'll be asking them to do to keep folks safe.
Sure. Mayor, you.
Well, it's in
I'm happy to
essence,
take that on.
we're having them, follow the distancing requirements and things. They'll be in the order. There's things like shields, and so that some of the facilities are doing now. So that's kind of the difference in the governor's order. He just describes essential services. We're putting within that, yes, we want all the essential services to complete, but we want to have distancing requirements for those that are staying in operation, even though they're deemed essential.
So requiring everyone to be operating at the same
Yeah,
level.
at the same level as possible. But the configuration of the stores is different depending on stuff. But the general guidelines, and remember the general guidelines, I keep saying, it's this social distancing and sanitation. I mean, that is the only weapon we have at this point in time. So, we're just trying to build those elements into these guidelines, into these now mandatory guidelines to help keep our citizens safe, even when they're out and about either providing or receiving essential services. Okay.
Yeah, so essentially, it's the 6 foot.
Right.
What HEB has largely been doing.
Right.
The social distancing, in addition to cleaning, sanitizing the frequently touched surfaces.
Hand sanitizers, things like that.
Was there another question? Okay.
Right.
That's all right.
Thank
So
you.
we'll excuse the judge and the mayor right now, and David Gonzalez and Dr. McNeil are going to come in. And kind of while they're transitioning, I know we have people that are just now tuning in to just give a recap of what just went on. We do have 5 new cases of COVID-19 in Victoria County. That brings our total to 20. Judge Zeller and Mayor McCoy just announced their stay home, stay safe order, which will go into effect at 12:01 tonight. That full order can be found online right now at VictoriaTXOEM.org. We also have the order from the governor on there right now, and the Seesaw document, which tells you what's considered a critical infrastructure or essential business. And then when this is over, we will have those documents posted to Facebook as well. We now have Dr. McNeil, our local health authority, and David Gonzalez, the director of the Victoria County Health Department, to give some updates on COVID-19 in Victoria County. Dr. McNeil?
Good afternoon, and today we are confirming the 5 new cases that were basically just released. This is a really fluid situation, folks, and it is changing every day. So this information, some of this information came in less than 15 minutes ago, so excuse me while I get all the stuff together. I can tell you that as far as demographics of the patients that we added to the list today, we're now up to 20 patients. And the patients we added today include a 30-year-old male who's been hospitalized, a female in her 20s that's under investigation, and a 20-year-old male as well. We also have 2 other patients that were basically, we were told about just a few minutes ago. We don't have the demographic information on them at this moment. I can tell you, as far as hospitalization, as hospital patients, we have a total of 6 patients in the hospital. While I'm sad to report that one of the patients is in critical condition or is very serious, I can happily tell you that 2 of the 4 patients from one of the facilities here in Victoria are going to be discharged home today. So we think that is a great victory. And of course, we've had no deaths here in Victoria. As far as the isolation orders, remember too that there are some other parts that we need to make sure everybody understands, and that is that individuals experiencing any symptoms of COVID-19, or if they have they been tested or have tested positive, these are all indications that you need to be isolated at home. So just experiencing symptoms, we've said this since the beginning. Of course, with the new orders that are coming out, that's going to be even more apparent. But if you have any symptoms whatsoever, you need to isolate yourself immediately. We're very worried about when the time that people begin to transmit this disease. And there's a lot of research out there, and there are a lot of studies going on right now, but they're being done. But you have to understand that this is a new entity. This is a new virus. It doesn't behave like other coronaviruses, and it doesn't behave like the flu. While they have some similarities, this entity, of course, can make people a lot more sick, and it seems to be more contagious. So we're not sure exactly when the business as far as when you become contagious is. We don't know exactly. We think that there may be a period of time when you're contagious even before you show symptoms. That has not been proven, but I've read a lot of reports that seem to point that way. So y'all can read those as well. The information is out there. So the biggest thing is that if you've been exposed, certainly if you've been tested and you met criteria to be tested, then you're suspicious for having the disease. Or if you have any symptoms, then you need to stay at home. And remember that we now have an order, and I would hate for it to come to this, but there are actually criminal fines if people do not obey those orders. We don't want people out in the public spreading this disease any more than it's already spreading. So what level of community transmission are we at? Excuse me. So that's been a big question. Where are we at as far as this goes? You can see that we always said that we would increase these orders commensurate with what the health of our people in Victoria are. In other words, the more people that get this disease, the more that we need to be aware. We've been proactive, and I would say that we're getting close to moderate transmission. I'm asked that question. They say, hey, are we at moderate transmission yet? And I say, well, I look at David, and then we together say we're pretty close. So we are getting very close. And remember, this is changing every day. Some of the patients that we see today are certainly consistent with being transmitted through the community, and that is very concerning, especially when some of the data now shows that there may be a period before you're actually symptomatic that you're able to spread the disease. So that's all about keeping people at home. It's all about being away from others. It's all about social distancing. Remember, I say it every day. That's the only thing we have to fight this virus. Okay. I'll be around for questions in a minute. David, do you have some things you want to add?
Sure. Thanks, Dr. McNeil. Just a couple of updates on testing numbers. I'm trying to want to provide you these updates as much as we can. Right now, total, we're up to 439 tests conducted for Victoria County residents. There are still 76 pending as of last update. We're still seeing a pretty quick turnaround on those, so we expect to have those results in the next day or two with those tests outgoing. Numbers with the 5 new cases we had today. Obviously, as Dr. McNeil stated, that we had a total of 20 for Victoria. That's going to bring our regional count up to 34. And that regional count, if you recall, is that Golden Crescent region that we had talked about, I think, a few days ago. Right now, just keep in mind, as Dr. McNeil mentioned, these cases are under investigation currently. That's why we still don't have all the information, demographical information on those cases. The investigations are ongoing. Keep in mind, we're limited staff with the health department to be able to conduct these investigations. Obviously, being a pandemic, this is unprecedented. So we definitely are at capacity with our staff. They're working as hard as they can around the clock to make sure that we do investigations. So you'll see days where we don't have complete demographics on all cases, but we'll get those out as soon as we can. So that's kind of where we're at right now. Other than that, I really didn't have a whole lot to report today. Going forward, what we want to do is pretty much coordinate the release of new information as far as case numbers at 5 o'clock every day. Before, we're trying to get them out as soon as we could on a daily basis, as soon as we found out. But I think as we move further along, it'll be a little more efficient to do them at one set time every day, hopefully for the media and the public to look for that information. So we're going to start doing that going forward at 5 o'clock today. And our PIO team is going to work and get that information as quickly out as accurately as possible once they get that information. And that'll be posted to the website and Facebook pages as they have been previously. That's really all I had today. So if there's any questions, I'll go and open up for questions right now.
Start.
Will you, for the public's sake, reiterate the definition for moderate transmission?
The question is the definition of moderate transmission. Remember that when we start talking about the ability of this disease to transmit, we do the contact tracing and we do all the important epidemiological studies, and they're working very hard right now. So when we look at these cases, we try to basically find out where the disease came from. If we cannot find a source, in other words, this person that we identify as a patient that's tested COVID positive, if we are unable to find exactly who they were with that was positive, or if they were at a certain club or at a certain, wherever they were, if we can't find that, then we have to assume that they just got it somewhere. And that somewhere is where they've been hanging out, and that's the community. So that, by definition, tells you what community transmission is.
Okay, so it's moderate community transmission.
When it gets to a point to where it's becoming more widespread, and those are the three definitions, is mild, moderate, and widespread. We're certainly not at widespread, and I hope we never get there. But we are certainly at the upper limits of normal of mild. Let's put it that way. Okay.
So yesterday a word was used, and I didn't quite catch it, and today it was reiterated, that potentially, most likely unknowingly, people who are infected are out in public. And, that they were saying that perhaps people who are showing symptoms, who might have maybe mistaken it for the cold, a common cold, or perhaps the start of the flu, were out in public. And you had just said earlier that potentially maybe you don't even need to be symptomatic to transmit.
What she's asking is the biggest question in medicine right now. And that question is as to, is it possible to transmit this disease prior to having any symptoms?
Right.
The initial information from the Centers for Disease Control, and it was on there this morning about 9:30 when I looked at the last time, was that typically patients transmit this disease with cough, fever, and shortness of breath, the symptoms that we always go with. But that being said, there's a lot of data out there that when we interview these patients, we find out that they may have transmitted this disease prior to the development of specific symptoms. But when we get back to them, and we talk to them, and then they may tell us, well, I felt some muscle aches, or I felt back aches, or I had a lot of congestion and I didn't feel well. We look back and we're thinking that was probably the symptoms of COVID at that time. Then we look back though at some, and they deny any symptoms at all. And that's when it gets really scary.
Okay, so I have a number of questions. The first one is for you, Mr. McNeil. So with the people who have already gotten COVID and have recovered and are put back out into the community, can they reacquire the virus?
The question is the reacquisition of the virus after being sick, and that has to do with the immunology of the disease. So in most cases, in most diseases, once you've had it, you will develop antibodies in your bloodstream that will fight this off. So the theory is that this will happen with COVID. I looked that up a couple of days ago, and the latest research says that we're not sure. We think that it does based on previous other coronaviruses that have been studied, but for the most part, we cannot guarantee acquired immunity if you've already had the disease.
Thank you so much, Dr. McNeil. And for you, as for the testing requirements, I know previously it was you had to have traveled out of the state or had come into contact with someone who was positive. Have those been lightened any, or is that the cause for more tests?
Yeah, I think we'll both touch on this. The question was regarding testing requirements, and right now I know they did essentially relax some of those requirements. Some of those strict requirements were for the initial round of testing at the public state labs that we would utilize. So there's a little more strict requirements early on because there's such a limited supply of those testing media available. So that those were in place. Now it's usually up to physician's discretion. If they feel they have symptoms similar to COVID and they may have a possible COVID exposure, then they would definitely recommend that. And Doc, I don't know if you want to add anything.
Well, the thing is the testing seems to be a big question because it's of great benefit to us. When you think about the fact that if you have a physician that was exposed to something or exposed to COVID and then they have to be isolated for 14 days, that takes them effectively out of the healthcare system. And that's okay for 1 or 2 doctors, but it's not okay with a whole bunch of doctors. So, and that's very potential, and we're seeing that happen in other areas. So, if we can find a way to test those people, and these rapid tests are coming, and that's the holy grail right now. We're really looking for that, and we're hoping, and I've spoken to people, and we're hopefully going to have that available in 1 or 2 weeks. And if that's possible, then if you have symptoms, you get a test. 15 minutes later, you're either isolated because you have the disease or you go back to work.
And as for the turnaround time for the positive test results or negative test results to come in, has that been improved since last I saw it was like 2 to 3 days?
The range from pretty much from the beginning has been about 2 to 5, 2 to 6 days. We're still seeing a wide variety depending on the lab, whatever lab they do go to. We're seeing some as quick as 2 days, and some are taking upwards of a week or later. It kind of depends on the lab piece, the private labs, as far as how long those are taking. Sorry, the question was duration of results awaiting positive and negatives.
And my last question, and then I'll let you have the
Yeah.
floor. So with the testing requirements before being so strict, do you think that there's a possibility that there could be more COVID-19 cases in Victoria County than what has already been reported because people didn't travel out and they got it from someone who maybe had it and was tested, but they were like, you don't really meet the requirements, so we won't test you because we have limited supplies?
Well, the testing, I guess your question is, did the early inability to test everybody affect our results?
Yes.
Yeah, okay. I think that's what you were saying. But I'm a simple man. But the thing is that in the beginning, we didn't have near the testing capability, and that's because the private labs in the private sector have stepped up. So the majority of the tests we do right now are coming in from these clinics and coming in from people that are sending the information to other people. So they're sending it off, we're getting the results back quicker. And to answer your question, we're going to see more cases. It just makes sense. The more you test, the more you're going to find. We have a rule in medicine. You don't find things you're not looking for. So when we test directly for that virus, then yeah, we will find more.
Okay, thank you. Just want to confirm a couple of things you said earlier, Dr. McNeil. Of the 20 known patients we have, 6 are currently in the hospital, but we expect that to go down to 4 later today.
Yes, ma'am.
Okay. And then of the 20 known patients we have, do we know how many have been determined to be community spread, David, at this point?
Yeah, I'll go ahead and touch on that one. The question as far as how many determined the current case to be community spread. Last count as far as what they could deduct, suspected community transmission had taken place in, it looks like 4 of the 20 cases right now. And there's still some under investigation.
Okay. And then do we consider any of our 20 patients recovered yet at this point?
Right now, I actually just spoke with the epidemiology team before I came out here, and I think we can go ahead and confidently say 2 of them have recovered, so that's positive as well. Definitely is a good thing.
And then Judge Zeller had mentioned earlier that factor in 1 or more cases of some of our COVID-19 patients is that they went to work while they were sick. Do we know if they knew they had COVID-19 while going to work or while going in public, or just thought they had a common cold or common symptoms?
Well, that's been a big problem, and that's a problem across the nation, is that, this morning I woke up and had a little bit of congestion, but I also have seasonal allergies. So there's the question. I mean, there are a lot of people that have such mild symptoms, and there are people that have mild symptoms, and they just ride it out, and they go on to recover, and they had COVID, and no one ever knew. But they were certainly able to transmit it during those times. So that's why we stress to people, if you have any illness whatsoever, or you think you're sick, or you feel like you have the flu, or you have muscle aches that you don't typically have without going out and working in the yard or something like that, then you need to think about not going to work, because there are a lot of patients that they're very dedicated, they want to go to work, but if they have the disease, they're going to transmit it, and then it's going to be a much worse situation.
I will add one thing to that. There's been one part of your question, there's been no evidence, no one that has been confirmed has gone out to public after that, though. We have no issues with compliance on that end. I just wanted to straighten that out.
Everybody has worked very well with the health department.
Absolutely.
Gentlemen, our hearts, of course, and our thoughts are with everyone who have tested positive, but in particular this critical patient. Is there anything that makes this particular patient different from the others?
Probably the most common comorbidity is that this patient is elderly. So that is one thing, but don't let that get your guard down, because we're seeing a lot of sick young people in Victoria as well.
Right, we talked about this yesterday. So many of them are in their 30s and 40s and 20s.
Right.
Absolutely.
I was wondering if you could, one or both of you could address, the judge and the mayor were talking about the new orders. If you're awaiting results for a COVID-19 test, you and your whole family should stay home. What does that mean? Does that mean you ask a neighbor to get groceries and they leave it on your front step? You literally don't leave at all? Can you kind of just elaborate what the best practices would be there?
Sure, and I'll touch a little bit on that. The question as far as the orders regarding any patients or individuals being tested, waiting for test results on COVID order to stay home, as well as their family. Yeah, that's one thing that they can definitely reach out to our operations here with the health department or the emergency operations center. If they're waiting results and there's resources they need, they can reach out to us, and we can try to coordinate that with the different entities that we have assisting us here in the EOC. Obviously there's, as far as groceries, deliveries and things are available, but we can definitely help those patients out if they're waiting that to help them comply with that order. We'll address
and
that.
just to clarify, when in those cases when we say stay home, it's genuinely don't leave.
Right.
Okay.
Right.
Okay. And then the other thing I wanted to ask about is in the governor's executive order, religious services are listed as essential, and can you just have advice for folks for either religious institutions or folks who might be attending, kind of what you would recommend to keep people safe?
I'll briefly touch on this one, a little outside my wheelhouse. So the question was regarding religious services. I know there's a lot of churches and religious establishments going to, I guess, web session. Sorry, I'm just drawing a complete blank. As far as services over the internet and the web. So, I mean, obviously we advise as much as possible to attend those. But, I mean, other than that, I don't know. If anybody
I've seen some things where they're getting pretty innovative. I saw a priest standing out in the parking lot, and everybody was still in their cars. I think they had their windows rolled down. They were just listening. So there are a lot of different things, but the bottom line is this. Nothing against churches, because I like church. But the thing is that you don't need to be around other people. And that means don't be around more than 10 people. So God would like you to stay home and pray, I think, as compared to going out and spreading this disease. So.
Do we have any other additional questions right now? If not, I'll go ahead and close this out for today. So I'd just like to thank the community of Victoria for tuning in. We've made it a priority to try and keep you guys as up to date as possible, and we'll continue to do so. For accurate information, if it's released on the Victoria County Public Health Department's Facebook page or on our website, victoriatxoem.org, it is accurate Victoria area information coming directly from your local officials. Our COVID-19 hotline for any questions you may have related to this new order is 361-580-5796. I'll say it one more time, 361-580-5796. This briefing will air tonight on Suddenlink on channel 15 or 115 at 6 p.m. And following the closing of this briefing, a recording will also be aired on Kix, Q92, Jack FM, and Club radio stations. For anyone with unmet needs, please call 211. The Texas Health and Human Services has also launched a 24/7 statewide mental health hotline. That number is 833-986-1919. Again, this is a statewide mental health hotline, and that number is 833-986-1919. Again, there are 5 new cases of COVID-19 in Victoria County, bringing our case count up to 20 and our regional count up to 34. Going forward, we're going to get all this information to us by 5 and upload these daily to our website and our Facebook pages as soon as we can after 5 p.m. And just in closing, Judge Zeller and Mayor McCoy announced their stay home, stay safe order. That can be found on the website, victoriatxoem.org. And later this afternoon, we're going to be releasing some infographics that are very easy for the public to understand. And if we need to, tomorrow we can actually get some of our legal team to answer the more complex questions. I thank you all for your time, and we'll see you again tomorrow at 3.
Thank you.